the Community Shelter Board. Sister Melissa Garver, she's the Director of Development there, and she's going to tell us facts and figures and options with respect to our homeless and hungry in Columbus. Let's praise the Lord for Melissa Garver as she comes.
Hello, thank you so much for welcoming me into your incredible community. A really uplifting morning. And I will be sharing some challenging things that we're facing in this community around homelessness. But as Dr. Wise shared, we all have the power to do something about it. And so I'll be sharing what we're seeing here in Columbus, and then sharing a few key ways that each of you individually, as a family, and as a collective church community can rally together to help our most vulnerable neighbors. Because as I felt very lifted up this morning, this is what we need to create for people who are facing homelessness. There were 15,000 people who experienced homelessness last year in our community, and it's thanks to stable homes that they are lifted up and have a path forward for opportunity for themselves and for their children. So the first, where is the person who's running this slide? Oh, up there, I see, great, thank you. For the next slide, Community Shelter Board, we have a few key roles in this community. Our mission, we are on a relentless drive to make sure that everyone has a place to call home. So for people who are facing homelessness, what are the services and programs they need to get back up on their feet? And our key purposes is strategy. So how, as a community, what are the innovative strategies that need to be put in place to deal with these really complex challenges? The other one is accountability. We have a huge role in making sure that we are delivering the best outcomes for people facing homelessness. We receive funding from the state of Ohio, from the county, from the city, from the federal government, and we oversee that funding to make sure that we are compliant with how we're using the funding, and again, making sure that we are achieving the outcomes that we need to for homeless and housing services. The other one is collaboration, because as you all, for your previous sessions have heard, there's lots of challenges, and many of these can overlap with people who are facing homelessness. So employment, mental health, the criminal justice, survivors of human trafficking, domestic violence, and those all overlap with our system of care as well. And so we do a lot of collaboration with our system providers, but also other systems in the community to make sure that we're lining up the services and the resources in the best way possible. The next slide, please. This is our partner agency network. Many of them you already probably support, like you did so generously this morning to Faith Mission. Faith Mission is doing incredible work in our community to provide shelter and safety to men and women. And many of these partner agencies, we are investing on the complete spectrum of homeless and housing services. From prevention, meaning how do we keep families stably housed, and then shelter to make sure there's a warm bed, showers, meals for men, women, and families, and then housing resources as well to help families and men and women transition quickly out of shelter with the financial assistance and the staff support that they need to make a successful transition to stable housing. And again, this system of care served 15,000 people last year in our community. For the next slide, please. As Dr. Wise noted, we live in a growing community, and there was an article last year in the Huffington Post that I think put it perfectly. It said that homelessness is no longer a sign of a declining community, it's a sign of a prosperous one. And Columbus, Ohio is a place that we all love to live, learn, and raise our families, and we want that to be the case for every single human being in this community as well. What research is showing by MORPC, which is our regional planning committee, is that Columbus will grow by 1 million people by 2050 in 30 years, and Franklin County alone will grow by more than 400,000 people. Next slide, please. For Franklin County, what that means, that will be 13,000 more people every single year. And just looking on what that typical proportion is on those that will be facing homelessness, that will be 150 more people annually. And that is independent of all other environmental factors. This is not thinking about what the next recession, when it might be and what it might look like. This is just kind of on the basic math proportion. This is what we are looking at. And as you can see from that image, when you think about the first year, okay, that's not too significant. But when you start building that upon year after year to 2023, that becomes a lot more significant. For the next slide, there's just not enough housing for everyone. We see this, the mention of Linden. Everywhere in Central Ohio, there's just not enough affordable housing. And rents are rising in Columbus faster than anywhere across the United States. For the next slide, please. According to the Building Industry Association, we need 14,000 units, and there's only 8,000 units that are being built every single year. So even just housing alone, that equation is already off. When it comes to affordable housing, that is housing that's needed for the people we are serving who are very low income. That need is 54,000 units. And when you think about people who are very vulnerable, that means for every affordable unit in our community, there's 3 people who need it. And that it just creates a very competitive environment, which is really great for landlords, not as great for the people that we are trying to get housed. For the next slide, please. So it is more and more difficult to house very low income people, and that's people that we're serving in our system of care. Average rents have increased almost 40% over the last 5 years. And when we look at that from a monthly dollar perspective, that means for every $100 increase, it signs a 15% increase in homelessness. High eviction rates are also very challenging for getting people rehoused because it's an instant red flag to landlords on their willingness to house people. For the next slide, please. The cost to rehouse families has more than doubled. And so as you can see here, back in 2013, and when we talk about rehousing families, we are providing that financial assistance and those staff resources to help families figure out, what were creating the barriers before. Was it employment? Was it childcare? Was it a lack of food resources? Is it transportation? And so with our rapid rehousing program, this is where we're connecting families and single adults with that first month's rent and deposit and those staff resources to help them transition successfully back into stable housing, because most people don't have that savings account. That we we want to rely on and build upon people that are very low income and that we're serving don't have that safety net. And I'll just say, this is how I got involved in this work. I've been with the Community Shelter Board for 12 years, and it was back when I was doing a service project for, it was in Kansas City, Missouri, and I was doing a service project for an organization that was helping families, young moms who were experiencing homelessness. And I realized in that moment when I was 19 that I had been, and I have a very grateful heart, but it was a very key reminder to me of how blessed I have been and continue to be. I have 2 loving parents. I had a stable home growing up, 4 siblings, and it was that part that I realized there were other things that we could do to help people who didn't have that safety net and didn't maybe have the same opportunities that I had growing up. And that is where my passion and commitment to helping people facing homelessness began. And I had the opportunity to join the Community Shelter Board team 12 years ago, and still every single day really committed with our community and have the incredible honor to work with our community every single day to raise resources to make sure that we are helping give people a path to opportunity and a path to stability. For the next slide, please. So families are both priced out and screened out of affordable housing, and the families that we are serving are facing generally maybe 1 or 2 or 3 of the things that we have listed here: evictions, convictions, and even maybe poor credit history or no credit history. And so when you're talking to landlords and they have maybe a family that doesn't appear to have as many risks versus a family that has multiples of these challenges, that's just that much more advocacy we need to do for that family and that young mom. For the next slide, please. There is a disturbing pattern of inequity for people who are facing homelessness here in Columbus and nationally. African Americans represent 22% of the general population here in Franklin County, 40% of those living in poverty, and 65% of those who are experiencing homelessness. This is especially for families when it's a young mom with 2 young kids. We are tackling these challenges within our system of care and also advocating with other community partners because, as was mentioned earlier by Dr. Wise, what are these structural inequities that have happened decades that have led to this? But what can we do as a system of care and as an organization? And we've linked together with other national groups as well to continue on this work. For the next slide, please. When we think about homelessness, and we might have known people who have experienced homelessness, I think a lot of people in our community do associate it possibly with the person who is on the street corner asking for help. And we do have those people and we do serve those people. There's also a lot of people that we don't see. There's a lot of families. A large majority of the people that we serve are families with young children and men and women as well. And just a lot of people that are needing services. And so looking at these numbers here in Franklin County, 10,000 people needed shelter, and we were able to shelter 8,800 of them. And this is due to a lack of resources. More funding is needed to make sure that we have a safety net for men and women. We currently are able to provide shelter resources to families all year round, just do not have enough resources to do that for men and women. But on November 15th, we do have what we call Winter Overflow, which Faith Mission is a part of, where additional shelter beds are added to ensure that there is safety and a warm bed for men and women throughout the cold winter months, which we can all feel the chill right now, right? Like it was brisk this morning, and so it makes it even more evident during these cold winter months. For the next slide. By 2023, we expect there will be 11,000 people who will turn to homeless shelters. And that gap means that gap increases. And so we're really saying to our community, now is the time to put our heads together and think about what are we needing to be doing as a community, as caring citizens, to make sure that everyone does have a place to call home. The next slide, please. And so we have asked ourselves, with our board and with our key staff and our key providers, how does a growing city get ahead of a wave of homelessness? We're sounding the alarm now because if you've recently been to Seattle or San Francisco, they are very challenged with the homelessness problem. And if you've traveled there recently, you've probably had the thought of, I don't know if I want to go back anytime soon. You're shaking your head, so you know. And that is not what we want to be. We want to make sure that we are and continue to be the caring, incredible community that helps our most vulnerable neighbors. And where we are looking to and the places that we see as greatest opportunity is prevention and rapid rehousing. And I'm going to talk a little bit about what both of those are here in a couple minutes. For the next slide, we're saying, do we really want another family shelter? We have 2 family shelters, probably also what you have supported, the YWCA Family Center, which is on East 5th, and the Van Buren Center down on the near west side, operated by the YMCA, and we support both of those programs. Over the summer and into the fall, our shelters, these 2 shelters, are very full. We have families, crammed into every available space just to ensure they have safety, a place to sleep. And last night alone, we had an additional 41 families above our traditional capacity in shelter, and over the summer, it was as high as 90. And when we talk about a third family shelter, the cost to that, there's a significant annual operating cost and capital costs. And so we're saying, what are the other services and resources that we can make sure we provide for families? Because shelter is not the best option. It's needed for a safety net, and it's needed in the ultimate crisis. But if we're able to deliver other resources for families that are better for the family, that's what we want to do. For the next slide, please. The first one is preventing homelessness, meaning how do we keep families in their own housing? How do we keep them successfully there? Are they living with mom? Are they living with their sister? Or did they stop paying rent because the landlord wasn't fixing? They needed to fix something, but they didn't realize they needed to put that into an escrow account to help protect them. So whatever it is, our prevention specialists are helping mediate those challenges so that way they can remain in their housing. When you look at the cost of prevention versus the cost of rapid rehousing, it costs about $2,500 to prevent a family from becoming homeless. And as you saw with the rapid rehousing, for shelter and rapid rehousing, that total cost is about $7,500. So both from the resources side as well as the human side of it, it makes really good sense. Prevention helps families prevent them from the delayed development and possibly repeating a grade, because that's what we see with kids who are in shelter, and we try to keep shelter stays as short as possible to minimize those consequences for kids. Because kids in shelter also experience anxiety, stress, depression, withdrawal. Because as you can imagine, those parents have to be extremely stressed for the situation they're in and trying to provide for their family in the best way possible. For prevention, we prevented 2,500 families from experiencing homelessness over the last 5 years. It's a national best practice, and we know how to do it, and we want to do more of it to make sure that we have a great solution for young families in our community. For the next slide, please. If a family does become homeless, we need to get them out of shelter as quickly as possible for all those reasons that I mentioned. And rapid rehousing is a national best practice that we piloted here many years ago, which provides the financial assistance, upfront costs for first month's rent deposit, as well as the staff to look at what is your housing plan. We've identified housing, but what is it about benefits, employment, childcare, your health, and providing those linkages where appropriate to help that family be long-term, successful, and stable. And to give you perspective for rapid rehousing, we rehoused 8,000 people over the last 5 years, and success rates in that program are generally around 85% or higher. So I have a little video on this next slide that I just want to share with you, and then I have afterwards some ways that you can help immediately as a family or as a collective congregation. But first, I just wanted to show this video because I think it shares in a different way the impact that people are making in this community with their wonderful generosity. The link is also in the notes section. Okay. Go ahead. Okay. So I am going to share some few specific ways that you can help. We have a campaign right now called Home for the Holidays, and this is where we are committed to getting as many families in home for the holidays, because when you think about Christmas morning and waking up, we want kids to be able to wake up in their own home and not in a shelter. And that is one key way. Oh, would you mind moving to the next slide? I'm sorry. And then the one after that. Thank you. This is where, on the next slide, I'll also share, even just sharing on social media, coming together as a congregation. You did for Faith Mission already, which is incredible. But if for your, I know the holidays create an extra level of generosity, which is wonderful. And so there's ways to give online, to text a donation, or mail a check to Community Shelter Board. As you can see, we make it super easy, as you do as well, which I saw earlier, which is incredible. This campaign last year housed 30 families through our Home for the Holidays campaign, and we want to do even more this year. And so that's where our community, through gifts, can come together as a collective to rehouse families in shelter. And for the next slide, you can inspire others. I was incredibly inspired this morning with all of your love and hugs and support, and you can continue to share that with all your loved ones, your coworkers, and sharing how you are making a difference and how they can make a difference, because one small conversation with someone about your time this morning will have a ripple effect out to this community. And that can be sharing on Facebook, that can be asking people to donate on your behalf for your Christmas gift, but that inspiration can continue to be shared in many ways. For the next slide, this is also just so you can stay more aware of our organization and the work that we're doing and how you can be a part of it. We are on Facebook, Instagram, and Twitter, and LinkedIn, and so feel free to follow us to continue to stay engaged, learn more about the impact of your involvement. And I'll just share an additional way too, because it's really time, talent, and treasure, all of those things that make a big impact. So in addition to a direct gift, a couple of our partner agencies, including Faith Mission and the YWCA Family Center, have a huge need for coats right now. It got colder sooner, and so the coat supplies at our shelter agencies have definitely dwindled. And so I just wanted to share that as an opportunity as well. They ask for new or gently used coats of all sizes. And so between supporting Home for the Holidays campaign and potentially collecting coats as a congregation, those are two immediate ways that you can make an impact right now. That is what I wanted to share this morning. I have time for questions. I just still want to say thank you again for having me here this morning, for inviting me in to your place of worship. I really greatly appreciate this opportunity to spend time with you this morning, so thank you.
Thank you. Are there any questions that you want to ask Sister Garver? As a question.
I just want to see that slide again, the one that has the ways to donate and so forth.
Right.
Oh, the ways to donate. Would you mind backing it up a couple of slides? It listed the text and
there you go.
The online. Yep, perfect.
Anybody else have a question? Here's somebody with a question.
Yeah, Faith Mission is located on Grant, downtown.
Where would you send the coats that you want to donate?
Yeah, for coats, for the YWCA Family Center is on East 5th off of 670 between Leonard and the 5th Avenue exit. They need coats of all sizes. Faith Mission is on Grant, downtown. I also have a couple business cards. I'm happy to give you addresses if you email me. The Faith Mission serves single adults, men and women, so they would need new or gently used coats for adults. Wonderful. Thank you again so much for your time. I hope you have a lovely afternoon.
Thank you. Thank you for your beautiful job. We appreciate it. One of the reasons why we have had such a connection to homelessness is because we as a church were homeless for a long time. For at least 8 years, we worshiped in a school because we had no building. So we understand homelessness institutionally and personally, and so we must make that connection.